my name is Michael Winkler and I'm doing this video for the nursing course Nursing 370, Transitions to Bachelorette Nursing. This is for Module B. So the scenario we're working with today is we have a patient who was admitted several hours ago with low LOC and is a poor historian. He's not been able to tell us what exactly has been going on. We don't know anything about this patient's medical history. Later, the patient has begun to roll around and shake and become sweaty. Now, at this point, this can be several things. This could be possibly the starting of the patient going into CWA. This could be low blood sugar or even something else. However, what I can test for right now in a very quick and efficient manner before calling the doctor is if they're hypoglycemic. So, at this point, I would actually call the CNA in. I'd hit my call light. I call the CNA in.
How can I help?
I need a stat blood sugar on this patient.
Alright, I'll get that right away.
So while he is getting the machine, we will go ahead and go over the 5 rights of delegation. The 5 rights of delegation include the right task, the right circumstance, the right person, and with the right directions and communication under the right supervision and evaluation. Now, the right task. This is absolutely the right task. This patient is suspected of having low blood sugar, and we need to check that to be absolutely sure that that is indeed what the cause is before calling the doctor. Now, the right circumstance. This is indeed the right circumstance where I delegate this to the CNA. At the moment, we'd be busy doing my general assessment of the patient, just to be sure that nothing else is possibly causing this that I can find, or that there isn't anything else wrong with the patient. So while I'd be doing my general head to toe, the CNA would be certainly the right circumstance for the CNA to be delegated this. And to the right person. I know this CNA is certified in medication assistant, which is what is required in my state of Washington to do this. I also know that this CNA has done many of these, and I've watched him do many of these. So I know that the CNA is proficient and the evaluation has been done. With the right direction and communication. This CNA, as you saw, was given the right direction when he came in. I told the CNA I need a blood glucose on this patient's stat. The communication was concise and clearly understood by the CNA, who left to go get this activity done. The right supervision and evaluation was also done. As I mentioned earlier, this CNA was evaluated and supervised doing blood sugars several times early on, especially after receiving his medication assistant per hospital policy to be able to do these at this facility. So we have on good authority that this CNA is competent to do blood glucose checks.
Which, for the record, their blood glucose is 45.
All right, well, thank you. This process was effective. The doctor, after being called and told of the patient's condition, ordered 20 milliliters of D50 IV push now, and a drip of D5W at 100 milliliters an hour. 90 minutes have now gone by, and the patient is now up with the blood glucose of 95. The patient is feeling much better at this point, although as you can see from this pumpkin face, that he still kind of looks a little off. Now, to make this process even more effective, what I also could have done is had the CNA get the vital signs. If the CNA got the vital signs, I'd have more to tell the doctor. Most likely, if I'd have called the doctor without the vital signs in this circumstance, he wouldn't be too happy. He might even ask for those before he ordered anything, which I doubt given how low the blood glucose was, but still, we should have had the vital signs ready for the doctor. So to make this process more effective, we should have had the vital signs ready for the doctor as well, along with the blood glucose. And this concludes my Module B assignment. I hope you liked it. We did a great job on the pumpkin, we thought. So, yeah. All right.